Welcome to Strategic Dementia Caregiver Part 1. My name is Kate, and I'm the Program Associate for Education at Age of Central Texas. At Age of Central Texas, our mission statement is to help older adults and their caregivers thrive as they navigate the realities and opportunities of aging and caregiving. We have five programs at Age of Central Texas, including our Technology Learning Lab, where older adults are able to get more familiar with the technology in today's world, including AI, scams, fraud, just different things that are becoming more and more prevalent in today's world. We have our Information and Resource Center. We can do some one-on-one consultation just to find what resources not only are you eligible, but that are most helpful to you when you need them. Our Thrive Social and Wellness Center is our adult day program where older adults can come get that social interaction in a safe place with our staff on site the entire day. We have activities that we do throughout the day, and this just gives caregivers a way to have that respite while still knowing that their loved ones are in a safe location. Our health equipment lending program, this is our durable medical equipment. Any medical equipment that gets donated to us, we are then able to lend out to whoever in the community may need it. And then our memory connection. So this is more of an online platform where older adults, especially if they're in those first stages of experiencing a dementia-causing disease, can have that cognitive stimulation and also interact with some peers. Primarily, this is again an online platform with a couple of in-person events, so they can do it from their home, so it doesn't feel quite as difficult to make it somewhere. So you don't have to struggle with transportation or just the timing of schedules. So if they're available, they can join any of the Zoom sessions that are happening that day. Okay, so let's get into how to navigate being a strategic dementia caregiver. Again, this is part 1, and so part 2 is also located on our YouTube content library if you're interested in watching it after this one. So for this first session, we're going to define dementia and try to understand both the causes and the effects, so those symptomologies that come out of them. So some of those objectives are describing dementia symptoms and identify possible causes of the symptoms, to list the appropriate action steps if dementia symptoms are observed, and to describe how dementia can affect daily life. So I want to start out with this video from Teepa Snow. I do just want to give the disclaimer that this was made with the language around dementia when she made it. So it has evolved since then and is still evolving. So this video uses the most current language for when she was talking about it, so it may be a bit more updated nowadays, but the information is still very relevant, and Ms. Teepa Snow is an occupational therapist with years of experience, and her videos and information are amazing, so if you're interested and learning more about her, what content she has after this, feel free to look up some more of her videos. But for now, we're going to start with her Dementia 101.
What you already know is not sufficient to guide you into the future.
So the first question is it or is it not dementia? But we actually have a question before that. Normal aging, not normal aging. Because before we start assuming it's dementia, what we need to figure out is this normal for this person or is something changing? And if it's changing, is it necessarily permanent or could it be something that we could fix, we could address, we could modify? A couple of examples to keep in mind would be something like depression, which is treatable, hypothyroid, treatable, medication problems, treatable, even a problem with hearing that nobody's picked up on, or a problem with vision, or a problem with a new medical condition, maybe like diabetes or something. So what you want to notice first is there a change? Is something changing? And don't make assumptions. We want to check things out. People deserve a good workup. We don't want to think, oh yeah, look, it's not normal, it's dementia. We want to think, I don't know that this is normal for this person. Something seems to be changing. And if we notice the change, we want to find out, can we do something? And if we do that and we're still going, ugh, something's going on here, we don't want to make the next leap, which is, oh, it's got to be Alzheimer's. It's bound to be Alzheimer's. Not necessarily. This is where there's a lot of misunderstanding about what's dementia and what's Alzheimer's. And what does it mean? It doesn't mean memory problems. When we talk about dementia, we need to be thinking about a great big umbrella term, a great big umbrella, as a matter of fact, that we find underneath that umbrella approximately 85 to 90 different conditions, forms, causes of this thing called dementia. And dementia is not maybe what you think it is. It's more, and it's different. Alzheimer's is under there. It's certainly one of the big boxes under there, but it's not the only box. And what we used to think, 80 to 90% of all dementias are Alzheimer's. And now we know they may be mixed pictures, a couple, or a different one entirely. Things like Lewy body or frontal temporal dementias, or maybe vascular dementia, or dementia that comes with a health condition. And we think now that dementia actually isn't a diagnosis. So if somebody has been diagnosed as having dementia, something's not right already, because you don't get a diagnosis of dementia. When you have dementia, you have a syndrome, a collection of symptoms. So what do we want to do? Well, we want to know we're under the umbrella. Well, what does it mean to be under the umbrella, to have dementia? Well, it means four things, typically. Number one, at least two parts of your brain are dying. They're changing, and we can't fix them right now. So your brain is changing on you, at least two parts. One of them will typically be related to memory, but not always in the way we think about. It's not always the can't remember new things, but do remember old things. For alcohol-related dementia, I have blackouts, but they might be a variety of blacked out or missing pieces. For vascular, I again could have a whole bunch of different memory issues. And for frontal temporal, I may think something happened that you don't remember happening. So with memory, it's important to recognize it's not just the standard thing. Now, the second thing that's true about all dementias is that right now, we currently have nothing that's going to fix it, cure it, make it go away, or even stop it in its tracks. So what we have to realize is we're going to have to figure out how to help somebody live with it. And on average, for all the dementias, if we considered all of them, we'd be talking about 8 to 12 years of symptoms. Now, it could be shorter, it could be longer, but 8 to 12 years is a long time to endure something that the third thing that's true about all dementias is constantly changing. And it's constantly changing because this is a neurodegenerative or a progressive illness. It's not going to stop until it's over. And now we get to the fourth thing that's true about all dementias. They're all terminal. But frankly, so's life. So what we've got to stop thinking is, oh no, and start going, oh, I'm going to have to make some changes. I'm going to have to do something because I am living with someone who's living under the umbrella. Now, let me say that again. When one person gets dementia, it doesn't just affect that one person. Everyone around them is going to be living with dementia one way or the other. So this one person got chosen, but it's not a choice they would have ever made. You choose. And the question is, will you pull together and support that person? Or will you fall apart and walk away? Will you wear yourself out and not make a positive difference? The purpose and the reason I do what I do is to help you do what you do. And that's where we can make the change happen. I can't change the condition. I can't make the changes stop. But what I can do is offer you ways to start changing, to better match what they're able to do, to acknowledge what's missing and use what they still have left. There's life under the umbrella for all of us. Life under the umbrella is a challenge when it's in you, but it's also a challenge when you're living with the person who's experiencing it. The choice is yours. With dementia, let's pull together, let's change, because the change is happening.
That was Tiba Snow's video on Dementia 101. Again, she has a lot more content out there if you're interested. She has content all over YouTube that you could find. Okay, so we've all forgotten a name, where we put our keys, or if we've even locked the front door. How many people have gotten into their car, driven down the road, and then thought, did I even lock that? Everyone forgets things once in a while. The question is, what's the difference between normal age-related forgetfulness and a serious memory problem? Serious problems with memory or cognition make it hard to do everyday things. So things like asking the same questions over and over again, getting lost in a familiar place, so somewhere you've been numerous times, not being able to follow instructions, becoming confused about time, people, and places, forgetting how to make a change or use the telephone, especially if this is something that you were perfectly able to do in the past. Difficulties with driving, not taking care of yourself, making poor decisions or judgments a lot of the time. Again, that misplacing things and not being able to find them, especially if it's occurring more often or occurring when it didn't typically happen in the past. Trouble having a conversation or forgetting the names of everyday objects. And then changes in those long held habits. So if you're somebody who normally has a very clean house and now it's becoming messy and you're just really struggling to do those things you used to be able to, or if someone's a very social person, they're very extroverted, they love going out and doing activities, and now they're withdrawing and things they used to enjoy, they just don't really want to do anymore. According to the National Institute of Health, dementia is an umbrella term for symptoms and the loss of cognitive functioning to such an extent that it interferes with a person's daily life activities. Again, dementia is that umbrella term. So it's a general term for symptoms or significant problems with cognitive functioning. So these are all of those symptoms that we've identified and talked about that fall into this umbrella term of dementia. So we just talked about what dementia is. Let's talk about what dementia is not. Dementia is not a specific disease. Again, it's an umbrella term, and so it describes the symptomology. There are multiple dementia experiencing diseases. So things like Alzheimer's, which are what people typically think about, or a lot of other diseases that we'll go into later in this presentation. Dementia is like not exactly the same in any two people. So in this presentation, we're going to go over some of the typical experiences of different dementia experiencing diseases. But remember that it doesn't happen the same way for every person. And the symptoms that one person experiences if they had Alzheimer's is not necessarily the same thing another person experiences if they're living with Alzheimer's. So take in this information, this knowledge, and some of these tips that we'll share within this presentation. But remember that it's going to be some one-on-one consulting of what works for you, or if you're the caregiver, what works for the person that you're caregiving for. Dementia is not on a predictable timetable. We can give you if it is more of a progression or if it occurs more overnight, depending on what disease it is. But it doesn't happen the same for everybody, nor on a predictable timetable. It could progress faster than typical or slower. It's just up to the person experiencing it. So it's very difficult to try to figure out what to expect, which is why we try to empower you with as much knowledge as possible. And finally, dementia is not who that person is. We recognize that it's very difficult when your loved one or somebody that you've interacted with for years is now showing up a little bit differently. The symptomology, they're really struggling with. But we do just want to highlight that that person is not, dementia is not who that person is. They are still the person they've always been. Their heart is still the same. They're just experiencing life a little bit differently due to the impacts on their cognition. So, dementia-causing diseases are divided into three groups: that primary, secondary, and reversible. There are over 80 different dementia-causing diseases. Some primary diseases are those that mainly cause dementia symptoms. These are the ones that you're going to be most familiar with, and that are kind of the primary diseases we're talking about when we talk about dementia. So, of course, that's Alzheimer's disease, dementia with Lewy bodies, vascular dementia, frontotemporal dementia, or mixed dementia. Secondary diseases are those diseases which have dementia symptoms, but that's not the primary physiological concern. So, these are things like Parkinson's disease, which are going to affect more of your movement, chronic traumatic encephalopathy. Sorry, that's a difficult word. CTE. We see this a lot in athletes. So this is when you get a repeated head trauma. So some athletes are experiencing multiple concussions across their lifetime. And so when they get towards the end of their career and they get older, their brain is really struggling. And so these repeated head traumas could have that dementia as one of the symptoms. AIDS is another one, AIDS dementia complex, and Wernicke-Korsakoff syndrome, which is a brain and memory disorder that happens when your body has a severe lack of thiamine, often caused by alcoholism. So this mainly causes vision changes or a loss of coordination or voluntary muscle movements. And then finally, those reversible, which are dementia symptoms caused by other illnesses, but it's something that we can change and we'll start to see those dementia symptoms go away. So we're going to talk about those a little bit more in this next slide. So those reversible dementia causing conditions are things like medication, so medication side effects or interactions between medications could cause dementia symptoms, vitamin deficiency such as B12, tumors in the brain, severe illnesses or infections, some thyroid, kidney, or liver disorders, which is the endocrine system. So that thyroid, kidney, and liver, if something is off in that system, it can cause dementia symptoms. Sleep apnea or insufficient sleep. So sleep is so important for your health. And so if that's being affected, you might start seeing those dementia symptoms that we've talked about. Some sensory changes, like changes in vision or hearing, and untreated depression. So depression is not a part of aging. However, older adults are at an increased risk for experiencing depression. We know that about 80% of older adults have at least one chronic health condition and 50% have two or more. And depression is more common in people who also have other illnesses, or in people who their functioning becomes limited. Depression could become more common for people who are really struggling with this idea of not being able to do the things they used to be able to do. So older adults are often misdiagnosed and undertreated for these mental health challenges because they normally attribute those symptoms to something else. So one of the symptoms of dementia is apathy or losing interest in things that they used to enjoy. That is a symptom of both dementia and depression. So it's hard sometimes for physicians to be able to tell what's truly going on. So this is why it's really important for you to recognize like the symptoms that you're seeing, catalog them, and also try to get help from multiple different resources. So use your PCP, but also consider consulting a psychologist. Try to see what's really going on. Okay, so let's take a look at some of those primary diseases causing dementia. And the most common form of dementia, and the one that most people hear about, is Alzheimer's. So one thing about Alzheimer's is it's gradual. It appears over time and it starts to impact that short-term memory loss first. And again, why it's so difficult to figure out if the depression is coming first or if the depression is a symptom of dementia is because it is that symptomology. Some people with Alzheimer's, because of the impact of their brain, are more prone to dementia as part of that Alzheimer's disease, which is again why it's really important to see that PCP and get that referral for a neurologist. They can do that testing. While medication is available to treat the symptoms, it does not slow the disease progress. So there is currently no medication available to counteract Alzheimer's, but there is some medication that is helpful to kind of reduce some of those symptomology, just to help out that daily living and make patients more comfortable, more able to, I'm so sorry. There we go. Make patients more comfortable and just have an easier day-to-day life. So changes in the brain due to Alzheimer's are those deposits of protein fragments or those plaques on the brain. And so they start to damage those nerve cells, and that's why you're seeing these symptomology. Dementia with Lewy bodies accounts for 10 to 15% of all dementia diagnoses and presents a bit differently than Alzheimer's. So this disease has memory loss, but it also has changes to movement, confusion, hallucinations, and sleep disturbances. So these Lewy bodies are abnormal aggregations or clumps of protein that are like going onto the brain, and that's why you're seeing the symptoms, because they're covering up those synapses that are needed to do those executive functioning and memory and controlling the movement of your body. Again, some Alzheimer's medications may be used to help with the symptomology. Vascular dementia is caused by problems with blood supply in the brain, either blockages or just regular bleeding in the brain. This one, unlike Alzheimer's or dementia with Lewy bodies, can happen more quickly. So the other ones, something is building up in the brain causing those symptomology, but this one could be a sudden onset because of something like a stroke or even something like an accident. So like you're falling and hitting something and there's bleeding in the brain, vascular dementia can start to occur. Next, we have frontotemporal dementia. So FTD is named after where it's occurring in the brain. So this is the second most common form of dementia in people under 65. So the typical onset is that 40s to early 60s. And this one can actually impact personality, behavior, changes in language, speech and understanding, and also those changes in movement. Because it's impacting your frontal lobe and those temporal, that is where that executive functioning is taking place and where those personality traits live, which is why it can impact the way that they're showing up. Mixed dementia. Many people experience a combination of diseases causing dementia. So you may have Alzheimer's and vascular dementia, or Alzheimer's and dementia with Lewy bodies, which can kind of increase that symptomology. So this is why it's really important to try and do that testing to see what's truly going on. It also is important to know if you do have that mixed dementia because then those medications can be more personalized and reviewed more regularly. So you're recognizing that something's not quite right. You're seeing these symptoms, something in your brain is flagging it of this is different than it was before. This is worrying me. So at that point, it's important to one, track what's going on, track the symptoms so you know if it's something that's a one-off or something that's occurring more often. Next, see that primary care physician. So that doctor who you've been seeing for years that knows you and they can kind of advise you on what to do and what they think is going on. The first thing they may do is refer you to neurologists. This is when you can do a bunch of testing and kind of figure out what's going on. But some of these tests can be lengthy, and a full workup will likely take multiple visits. And then finally, don't give up if the cause is not determined. Keep seeking answers, get that second opinion. It's important that you seek those answers for yourself or your care partner so that you can, one, get access to more resources, but two, just know what's going on. It gives you a sense of safety to feel like you understand what's happening, not only with your body, but with your brain. Which, as I was saying, that diagnosis is helpful. You want to know what's going on, you want to know what to be prepared for. Sorry. But what's more important than that diagnosis is having a good medical team. Your medical team are the people that are going to get to know you. They're going to get to know your symptomology, and they're going to be able to tell when something is progressing or changing and make changes to medication or lifestyle in regards to those noticeable changes. And so they're going to be your first line of defense when you're not really sure what's going on or what to do. Education and resources are great, but at the end of the day, you need that medical opinion and that medical team because this is affecting your brain and your body. So, some sources of information. So, you just got diagnosed, or you think that dementia may be something you're experiencing or that your loved one is experiencing. And so, some sources of information, community organizations. Community organizations like us here at Age of Central Texas, Area Agency on Aging, Alzheimer's Texas, or Alzheimer's Association of Austin are all community organizations that have resources and programs that can help you in not only learning more, but also giving you those resources like the memory care that we have or the durable medical equipment. So if you're experiencing a need for something, a lot of these community organizations are going to have programs that can help meet those needs. Online information and websites are super helpful. Just make sure you're paying attention that it is a credible source. Things like a .org or .edu are much more credible than something like a .com, but also just checking to make sure that the people who are posting this information seem credible. Are they medical professionals? Is it from a community organization that is credible, like Area Agency on Aging? Just making sure you're checking these things. Seminars and conferences, or classes. So many community organizations or educational facilities will offer these seminars on different types of dementia causing diseases or different aspects of dementia. And so these may be helpful to gain more knowledge and also skill with caregiving. And then, of course, print material. So there's many books out there on dementia or caregiving. And then one of the most important things is that support network referrals. So if you are a caregiver or see yourself becoming a caregiver in the near future, It is so, so important that you look for those support networks, and not only in your personal life, but also other caregivers. So we have caregiver support groups here at Age of Central Texas, and it's just so helpful to feel heard and validated by your peers, and also have somewhere where you can come to just ask questions, get more information, and share what's going on with you or your loved one. If you're interested in a support group, feel free to contact us through our website. We have the form you can fill out if you're interested here, or there's other support groups within the Austin area or wherever you live that we can help you get in contact with. Okay, so activities of daily living are those things that you learn to do pretty early on in life, like walking, being able to feed yourself, dressing yourself, toileting, bathing, all of those things that you need to be able to do to maintain your daily living. So these are things that as dementia diseases are progressing, they may struggle with doing. So these are things that either a professional caregiver or you as a caregiver may need to start jumping in to help with. And we're going to talk about some supporting things that can help you with stepping in with these activities of daily living, but still giving your care partner some autonomy and independence. Next, we have those instrumental activities of daily living. So these are things that you need to be able to do to live independently. So those things you learn to do when you're a young adult or an older teenager, like managing your finances, managing transportation, whether you drive or you learn how to navigate the bus system, shopping and meal preparation. So knowing how to make that grocery list and be able to plan out what you need for the entire week. House cleaning and home maintenance, managing household communications, and then the big one that we see a lot is kind of that red flag for people is managing medication. So being able to know what to take and when to take it. And this is one that older adults experiencing dementia symptoms start to struggle with first. And this can be very dangerous if they're taking a medication too often or even not taking it at all. Okay, so supporting that independence with ADLs. So here's just a couple of things that you could do to help support that independence and so that older adult is able to do things themselves, but just with a little bit more support. So adaptive clothing. This might show up as an issue with making it to the bathroom in time or frustration getting dressed. Like if something has a lot of buttons and they're struggling with that fine motor skill of getting all of those buttons done up, this may come out as frustration. They may get annoyed and feel like they can't do it themselves, which is very hard. So having just t-shirts, limiting that closet to things that they easily can manage themselves goes a long way in maintaining that independence and autonomy. Organization and labeling. So having things in the same area all the time so they're easily able to find them. Or labeling things with instructions. So one thing that some people recommend is sticky notes. So having post-it notes around the house, like on the fridge with here, there's a sandwich in here for lunch, or by the phone of call this number to talk to so-and-so. Just that they're not needing to pull that information up from the brain themselves, but are able to just read it in the moment and do those activities that they normally do throughout the day. Remote controls. So one thing that I've seen is taping off the remote control of all of the buttons that they don't need, and then having little arrows of like this turns the TV on and then this turns the channel. That can be very helpful and making it so they don't have to remember exactly how to use everything and getting overwhelmed by all the buttons, but still being able to independently turn the TV on and off or find what they want to watch. Location devices, something like an AirTag or tracking ability, either on their phone, which is super helpful, or having an AirTag attached to their shoes or something. That way, if they were to leave the house and they get lost or something, you're able to easily find them so it doesn't become an unsafe situation. Medication management, there are lots of different resources for medication management, like the timer medication compartment. So they're only able to open it when they need to take the medication. There's lots of things if you just look on Amazon or different websites that can help you with that medication management. So they're still able to do it themselves. You would just need to step in to do the prep work. So one question that we get is, when does a family member become a family caregiver? So early on in the diagnosis, you and the person diagnosed with dementia-causing disease are really care partners. The dementia symptoms, especially if it's something like Alzheimer's and it's more of a buildup, they're more subtle in the beginning. And the care partner, you guys can work together. So they're starting to experience some of these changes, but they only need a little bit of assistance. So you can kind of work together to find out what works for them, what works for you, how you guys can make decisions together to help them in their daily life and to start to transition to that caregiver role. But once you start stepping in more often, once you start taking over more of those instrumentals and even activities of daily living, that is when you gradually start to see your role changing into that true family caregiver. So, one thing with this is that once you recognize yourself as a caregiver, is when resources start to open to you. Again, those things such as those caregiver support groups or different resources in the community that may help you and your care partner. So it's okay to recognize yourself as that caregiver, because at that point, it's also okay to ask for help. We recognize that caregiving can sometimes be difficult and can sometimes be overwhelming. So please ask for help, utilize those resources, and then just continue learning, continue gaining that knowledge so that you know what to expect. So daily life will be different and it can still be good. So try to understand the dementia causing disease and the common symptoms. Grow in your caregiver skills. Connect with other caregivers. These are all things that will help you in this transition into that caregiving role, because dementia impacts not just the person with dementia causing disease, but also everybody in a relationship with them. It's important for all of us to understand that the chronic disease or condition causing dementia often progresses slowly with certain recognizable stages. And starting to learn how to understand the situations and manage these new tasks is very important, and also just going to make life easier, because it can feel overwhelming in the beginning. It's a completely new skill that you're still learning. So that takes us to the end of part 1 of our strategic caregiver dementia. So here's a QR code to our website. And also on our website is contact information for us and resources. And I hope that you tune in to part 2, which is also located on our content library of YouTube. I hope everyone has a great day, and I hope if you have any questions, please feel free to reach out to us at any time. Thank you so much.